Thank you, Pierre. So we had a really nice size workshop on preparedness for emerging diseases, so we had stakeholders in the room. From all the important stakeholders were there, from public health, from academia, from industry, regulator, and from other organizations and funders. This workshop was organized in collaboration between us at IMI and the European Commission and European Federation, FPA, the European Federation of Pharmaceutical Industries and Associations. So it was a collaborative workshop. Next slide, please. Can I move the slides? Okay. So the objectives were to gather input from the stakeholders. So we really wanted to hear from the different stakeholders their views and vision on what it takes to establish a comprehensive strategy for medical countermeasures against emerging diseases. So we wanted to identify the gaps, importantly, the missing pieces towards such a comprehensive strategy, things that are gaps that are not already covered by other efforts and initiatives, also with in mind carefully the consideration that we want to avoid duplication of funding. So the output of this workshop, what we expected as output, was to identify what the missing pieces are, and then how should they be addressed? Which part should be addressed by public funding, and is there a role for industry to play, and is there scope for public-private collaboration, and specifically for a public-private partnership program under IMI? And as you will see, in this field, there's obviously a lot of things that need to be done, but perhaps IMI is not the right tool for this. So we are far from actually having a concrete plan to launch something under IMI. We are at an earlier stage was this one, where we really want to explore in collaboration with the European Commission and with industry what needs still to be done, what is missing, and how should it be addressed. So we had different sessions. In our setting the scene sessions, we heard from the WHO and ECDC, the European Commission, and then a new coalition that was recently put in place. The message from WHO really was that they have launched an R&D blueprint for biopreparedness. The message is we cannot repeat the Ebola experience. We must have a preparedness strategy in the future. And one important point that became very clear during the discussion throughout the day was that WHO has the mandate to define the priorities. Then ECDC gave a very nice overview of important research gaps identified for specific threats. And one point that was also made by ECDC is the importance to develop a code of conduct for collaboration between the public health institutes, especially the national public health institutes, and industry, because some of those public health institutes cannot work in collaboration with industry as per their regulations. So it is important to define areas where they can collaborate and put a structure and a code of conduct in place that would allow them to exchange and discuss, maintaining the scientific independence of the work that's carried out by the National Public Health Institute. We have a project at IMI Advance on vaccination benefit risk assessment that is going exactly down that road, and they are in the process of developing such a code of conduct. And that's so here the innovation really is to define ways for collaboration between those two different stakeholders that have no history or maybe a history of not working together, but where that is lacking. Then we heard from the European Commission. Their research priorities really cover the entire area from prevention through surveillance, early detection to intervention, and also capacity building. An important point in that respect is that they have some flexibility built in upfront in their projects that can change their priorities in an outbreak situation, so that would allow them to address the current outbreak. Also in the financial regulation, they have some flexibility that allows them to support programs in an emergency situation without a call for proposals, so they don't lose times by going through the process of launching a call. We then heard by the new interim chief executive of the Coalition for Epidemic Preparedness Innovations. You might have seen that this was in the news over the last weeks and months. So this is a coalition that was put in place following several calls of action for epidemic biopreparedness. And they're based on the principle of equity, so equitable access for vaccines wherever they're needed by whomever they're needed. They are looking for financial support, and there's a role there for several players, for the governments first of all, but also potentially for other funders and organizations. In that respect, one important point made that would convince people to support, or governments to support such an initiative is, for example, things like a better understanding and a better analysis of what the cost would be of not investing. The primary focus of CEPI is on vaccines, which triggered a discussion whether we wouldn't optimally want something that was broader than just vaccines, including also therapeutics and diagnostics, and whether there should be one organization, one coalition covering all of that, or perhaps separate entities. Then our next session was on some of the key determinants, early detection and diagnostics. So there was consensus that diagnostics are important. So when we had Ebola, when we had Zika, Mark Miller from bioMérieux, he stressed that people were crying for diagnostics, and we didn't have them. So everyone agrees they are important, and they should not be restricted to certain type of assays, nor settings, nor pathogens. Because as Mark puts it, we have been surprised every single time in the past, and we will be again in the future on what it actually is, the threat to come. So we don't want to restrict anything to what we believe now will be the next threat. Industry, so the diagnostics industry, calls for standardized and well-characterized biobanks of clinical specimens. So this was a lack. This was something that is missing. On the other hand, we had people from public organizations in the room who said they have specimen collections available, for example, collected during the recent Ebola outbreak, and they cannot get funding to render them sustainable. So there we clearly identified the need to talk to each other a bit more. One need that was identified was for laboratory capacity building, especially in those countries potentially affected by future outbreaks. There is a need to streamline and clarify regulatory pathways, and after we put this down on the slide, we actually had a presentation by Marco Cavalieri from the European Medicines Agency, so perhaps it shouldn't sound as negative anymore as it is now in this bullet point. And then one last point that was raised during that discussion on early detection and diagnostics is the importance of data sharing, collecting and making available data, for example, sequencing information. And in that respect, it was also noted by WHO that there's changes in the regulation. Now, in case of an outbreak, the recommendation by WHO and others is now information and data must be shared immediately. Then on vaccines and therapeutic development and clinical trial networks, the key highlights made were that, again, to clarify and streamline regulatory pathways, then a point that was made is that very often we think about projects, we finance, we support single projects, and we should move away from that and rather think about sustainable infrastructure. So away from project mode to a sustainable infrastructure mode. Very important is site preparedness, capacity building to establish networks for clinical trials, especially in those countries where the clinical trials will then be conducted. There is also a need to plan for surge capacity, which is really the issue when we have an outbreak situation. Then the One Health approach was noted as being very important. And gaps were identified in epidemiology expertise, biostatistics expertise, and also vaccinology expertise, especially, but not limited to low-income countries. So, deliverables or action points or potential areas where collaboration should happen are summarized in this next and last two slides. One overarching challenge, really, is the lack of certainty on the pathogens to prepare for, both for vaccines and therapeutics especially. And this means that for industry, it's really difficult to invest if they do not know what the next threat will be. In terms of diagnostics, we identified that there's a huge potential for collaboration between stakeholders to define better what the needs are in the field, to define better what the biobanks should actually include. There is a need for sustainable biobanks, but there's a lack of what samples exactly should be in there. Agree on what specimens are needed, on protocols also, and on the standards. There was specific for diagnostics one area where public-private collaboration could potentially make a difference is to develop regulatory pathways and to identify means of accelerating ethics approvals, because this is really something where also the industry should be involved. Then this CEPI, this Coalition for Epidemic Preparedness Innovations, and other initiatives that are being proposed by different people, both private and public, there might be a potential role for IMI, so this is something that should be further explored. On the therapeutic side, more efforts are needed into elucidating disease mechanisms. Then making a link to the advanced therapies, there's some capacity that could be increased there and that might be useful here. Some of the CEPI mechanisms that are now developed for vaccines could be leveraged also for therapeutics, so that was one conclusion as well. Capacity building in potentially affected countries is key and must be sustained. And one example that was made by, we had Michael Makanga from the EDCTP here, is the creation of centers of excellence by supporting institutions that have a career development strategy in place. So this would also help with sustainability, because the point was raised for example, based on the Ebola epidemic, a lot of people from affected countries, for example, Guinea, were trained and Marie Polkini from WHO mentioned that. So they have several hundred trained people there that now are without a job, and this is not sustained. So a solution to that would be to, instead of supporting individuals, to support institutions and to create these centers of excellence. More work, and this became apparent throughout different sessions and was raised by several speakers. More work is needed in social science to address the acceptance of clinical trials, both with vaccines but also with therapeutics in affected countries, and also prepare for deployments. And in that respect, also to improve communication and address vaccine hesitancy. And here I'd like to point out perhaps that in our Ebola Plus program, we have one project, EBODAC, who is dealing exactly with that. And it's quite fascinating, the work they're doing to prepare people in a remote area of Sierra Leone for accepting and participating into the clinical trial they're conducting there. So one point that was made is that we should be careful to avoid about having too many initiatives and duplication of effort. So it's important in the way we communicate and in the way we plan for future activities that objectives and the responsibilities of the various undertakings and the various projects are clear, and that we don't give the impression that we are funding too many things that all have the same objectives. One point that was very clear is that the public sector should take the lead in prioritization and also normative work regulation activities. So that's something where industry might not be, is not expected to take the lead. So, and last, there was a point made that there's also a need for more effort on vaccine efficacy, assay development, correlates of protections and things like this. And there's a potential for some collaboration there, perhaps also between public and private. And I believe I'm done, so thank you very much for your attention.
Thank you, Angela. So any questions for Angela? Comments? Yes, Denis?
I'm completely ignorant of your field. I was in the oncology workshop, but you have identified a number of challenges, like for instance, biobank, biomarker, access to clinical trial, regulatory issues. You have also identified, for instance, site preparedness. And actually, we have the same issue in oncology. We discuss in the oncology how to access to that patient with that rare mutation, that site for which we have not activated a clinical trial. So my question to IMI, maybe not specifically to you, is whether there will not be actually learnings from that field and oncology where we can maybe put efforts together. Because I have identified that from your presentation as common issues.
I think it's a really important point, and you might know that in IMI we now have this structure with strategic governance groups that support development of activities, including calls in specific areas. And I think we've realized that, and we're trying to avoid. I mean, speaking about silos, we've seen that previously. We don't want that. So I think we should make a very good, serious effort to avoid that. We have started to invite SDGs one to the other to ensure that we cross-link and we actually are aware and learn from each other. And so I think it's a good point that we should take very seriously.
I think, Denis, we have identified the fact that in general, we don't do enough connectivity between or among IMI projects, and this is something that we need to look at very, very carefully. So I think your point is well made. Magda?
Just dwelling on the point, essentially. So closing the triangle, similar issues were identified at the ATMP workshop as well. And I liked Angela's comment about moving from projects to sustainable infrastructure. I think that is the big challenge to IMI, the strategic governance board, the coordination, supportive actions. All these could be mechanisms towards connectivity, but certainly worth exploring.
Yeah. Thank you. Jean?
Thank you, Angela, for excellent feedback. So I just wanted to stress one point which is not fully clear to me. You mentioned that the feedback that WHO should set the stage for Europe. In fact, that was one of the questions we had during the symposium. Should Europe embrace the 11 targets globally, or should we focus on something that is specifically to Europe, for example, because there is some epidemiological threat in Africa, in Middle East, or should we really be on the same battlefield at the whole global health and, for example, BARDA and Wellcome Trust and others? So that's really a reflection for IMI too and for the European Commission, whether all list of infectious disease threat is exactly the same at the global list. Because, for example, we have the unique EDCTP in Africa, so there might be some pathogen there that have a risk, given the exchange we have in Africa, that of particular relevance for Europe. So we might have, and you know that CEPI didn't put in, flu pandemic at the list. Yellow fever is not part of that. Tuberculosis. So maybe we should be perhaps thinking a bit as European citizens to have our own list, which would be part of WHO and complement the efforts.
Yes, I think that's definitely part of the discussion, and I'd like to broaden that question a bit and ask whether should we at all focus on specific pathogens for something we want to do under IMI? I mean, it should be done for some initiatives, and perhaps for ZEPI, that's fine. But for IMI, should we really, and this is a point that came up during the discussion at lunchtime today, at IMI, should we take the risk and invest into some key priority pathogens now that might not be the right ones in the end, or should we at IMI rather invest on the enablers for whatever it will be that can in the future better address the threat?
I vote for the latter. I mean, I think it was Mark who said it, and I'm sure it was said by several people. We are going to be surprised. There's no way of knowing, and we will be surprised. So, trying to do things on specific pathogens at our level, I'm saying, at our level, is going to be hugely challenging.